Welcome back to Mental Maps. As always, I hope this finds you well no matter what season of life you're in. Today, we're talking about a topic that you may feel like isn't very mental health driven, but it is very mental health driven. And it is the concept of not only functional health, but pain, metabolic health. And to do that, we have a guy that is trained in functional health medicine, as well as he does a lot of chiropractic work. And we have with us today Dr. Kevin Smith. Kevin, welcome.
Thank you very much. It's a pleasure to be here today.
Man, we were so happy to have you. And so, we were talking before the show just how you got into this space. And one of the things that you had kind of noted to me was you work a lot in the concept of pain. And so pain is such an interesting, I mean, we know that epidemics that have experienced through the pharmaceutical industry are based around pain, right? And so can you tell us, how does functional health intertwine with pain?
That's a great question. First of all, I want to define functional health, functional medicine for your listeners so they understand a little bit more about where I'm coming from. So, for me, functional medicine is a patient centered, personalized approach to healthcare. It's kind of like a concierge style of healthcare as opposed to the one size fits all approach that most people get when they visit their primary care physician. So, no matter if somebody has back pain, for example, what the PCP is going to do is he's going to give them a prescription for an anti inflammatory or a muscle relaxer or a physical therapy script, or he's going to refer them out to his friend down the street that's an orthopedic guy for evaluation and management. Whereas I'm going to ask the question, why do you have back pain? What's going on below the surface that's causing this problem? Whether it's a metabolic issue, such as um, I don't know, an organ dysfunction, or a problem in the spine itself, or a trauma, or something like that. So what I want to do is figure out what is driving the problem that is bothering the person in the first place, as opposed to just masking the symptom with some kind of a drug.
Mm. And you kind of bring up the concept of that there's numerous reasons this pain is occurring. For you being in the world of chiropractic for so long, how many times do you see these chronic back issues, the lower back pain, the neck issues, the shoulder issues being related to not a true spinal issue or like a true shoulder issue, but due to something different?
Well, when it comes to the spine itself, it could be a referred pain coming from an organ, or it could be, I mean, if you dig really deep down, it could be coming from primitive movement patterns that started when you were a child, when you were
Mm.
learning how to walk. Or it could be coming from, if it's an extremity, maybe it's coming from arthritis, or maybe it's coming from an old sports injury, or a auto accident injury or something like that. But what's very curious is that only 10% of the body's nervous system conducts pain signals. That
Hmm.
means that 90% is not pain. It's about function. So it could regulate things like your posture, your balance, your proprioception, the special senses like vision, hearing, smell, taste, touch, things like that. So a lot of people that have these uh, back issues or extremity problems, as you pointed out, they could also have some other kind of a issue that is non-pain related, but still needs to be explored.
Mm. 10%. What do you think is the reason that that 10% just has so much power in the body and the mind?
Well, I have my theories. I think that one of them is that it's a instinctive survival thing. It's
Mm.
to help tell the body to protect itself
Mhm.
if there's a imminent threat. Um, there's a lot of people that have pain because of a chemical imbalance, or because of a mental problem, or because of a metabolic issue that's separate from musculoskeletal problems, such as a bone that's pressing on a nerve that's causing the pain, or because of arthritis or because of spinal degeneration causing your discs to start to
Yeah.
flatten out. It happens in older age.
Mm. Okay. Yeah. That makes a lot of sense. And it makes me think too, there's couple like medical conditions, right, that happen in health where the concept of functional health is really getting popular, right? Psychiatry is one of them. We talk all about that on this show. But I think the concept of pain is so interesting because more times than not, most of our interventions are really just attempting to mask pain, right? An
Yeah.
anti-inflammatory, some type of norepinephrine drug that's going to kind of modulate pain in a different way. So when you think about root cause illness and you think about root cause treatment, pain is one of them that there's definitely a need to figure this out. And so for you and the work you're doing, how are you helping people find this stuff and figure out why their pain and all these things are happening in their body?
Well, let's speak about the musculoskeletal stuff first. Um, a lot of people that have pain, chronic pain, they feel stuck. They don't know what to do about it. Like, where's it coming from? So it could affect their mobility, their ability to walk. They have to be very mindful about how many steps that they can tolerate, because if they have chronic pain in their back or chronic pain in their knees, they tend to have to park their car close to the entrance of a grocery store, or uh, be mindful of how far that they can walk to see their grandson at the little league game, or it interferes with their sleep. They end up having to toss and turn and not get a good night's sleep, which then affects their mood and their productivity the following day. But we want to evaluate all the different tissues. We want to evaluate the joints. We want to make sure that the joints have good motion, that there's no arthritis, that there's no inflammation, and it's smooth like ice gliding on ice. We want to
Mm,
evaluate the soft tissues like the muscles, ligaments, tendons, the meniscus in the between the knees, or we want to evaluate the neurology itself to find out what's going on behind the scenes. So rather than masking it, we want to figure out what tissues are involved with the pain mechanisms. And to your question earlier, I believe that the autonomic nervous system, which is your fight or flight response, is there to protect you against danger. So either you want to run away from the danger or you want to fight it, and that is controlled by uh, the brain and the adrenal glands, and they produce things like cortisol, epinephrine, norepinephrine that can help you to survive a dangerous event or run away or fight for your life. But there is a very, very complex topic, and there's a lot of moving pieces and parts that are involved.
and one of the things that I see a lot is that you're having people who are mentally unwell or they're having issues in that space. And we kind of talk about that, in another component. But you referenced something that was really big is just the toll that chronic pain takes on you mentally. Right. Like I've worked with people who it's
Yeah,
just
yeah,
debilitating, right, mentally for someone to kind of navigate that.
yes. So with the without getting too caught up in technical terms, there's a part of your nervous system and your sensory division that sends signals up to the brain, and it's in the brain stem, and the the pain mechanism that happens when people have chronic issues, that's kind of like an alarm clock, and it sends
Mm,
signals to the brain to wake it up, and it prevents you from going to sleep and having a full night's restful, replenishing sleep. So people with chronic pain have problems either falling asleep or staying asleep, and that completely wrecks their day the next day because they can't relax and they can't recharge the battery up here. And um, it's a problem. I'm not anti-drug, I'm not anti-doctor. I believe that there's a time and a place for all healing. There's a time and a place for drugs. There's a time and a place for surgery. There's a time and a place for chiropractic care and physical therapy and all the other different healing disciplines out there. And I think that one of the considerations is what's in the best interest for the patient.
Mm.
That's something that a lot of doctors don't really focus on enough. They focus on uh, what's convenient, what's fast, what's going to get me paid, and they're out the door. Whereas I think that people need to have an advocate to understand what they're going through and what could be all the different contributing factors that is causing the pain.
And that is holistic health, right? This whole concept, functional health, whatever, all the way, what it really needs to be is just health. But what we are kind of doing in these spaces of trying to figure out these root cause drivers is kind of leading people to being mentally or being physically unwell, mentally unwell, all those things. Something that I would like to ask you about, you're kind of talking about the musculoskeletal system, and there's a place for a lot of different treatments. But something we don't talk enough about, I think, is prevention. And so for you being in chiropractic and just in that world, what are things that people can do day in and day out to prevent some of these just terrible things that can happen in your musculoskeletal system that debilitates you later on in life?
That's a great question. So I found that I focus on six components, the six pillars of wellness,
Mm.
that if people would just focus on these six things, they could stop taking so many drugs. We live in such a drug culture and we live on so many pharmaceuticals. The average person that comes into my office is taking 7 drugs.
Wow.
And the most I've ever seen in my career, a guy walked in my office with his drug list. It was a page and a half single space typed.
Mm. Mm.
Think about that for a minute. All those drugs that he's taking, and he's walking around like a zombie. But anyway, to your question, there are six pillars of wellness that I advocate, and I tell everybody to pay attention to these six things. Number one is nutrition, making sure that you're staying away from ultra processed foods, fast food, fried food, all that stuff. Make sure that you're focusing on lean meats, fruits, and vegetables, and you're getting the maximum amount of nutritional benefit that you possibly can. Number two is hydration, making sure that
Oh.
you're constantly putting water in your system. If you don't, you're going to have a serious problem. You're always losing fluids every time you go to the bathroom, every time you sweat, every time you breathe. You are losing precious, uh, precious water. So make sure that and I'm not talking about coffee and tea and beer and all that stuff. I'm talking about clean, filtered water for your system. Um, a plumber friend of mine said that if you don't use a filter, then you are the filter. I
Mm.
thought that was cute.
Mm.
So anyway, number
Mm.
3 number 3 would be sleep. Making sure that your body is getting at least 6 to 9 hours of restful, replenishing sleep. Some people need less, some people need more, but making sure that you're recharging your battery every day for maximum productivity and healthy cognition and memory. Uh, Number 4 would be, stress management. People have too many plates that are spinning in their head, and I think that it's made worse by watching too much TV and playing on the internet too much. But if you do certain things to make sure that you are relaxing and meditating or doing something to mitigate the stress, that we all have, that's very important. Whether or not I'm a big advocate of doing kind of a mind dump where you're writing down in a tablet everything that you're
Mm.
thinking about until there's nothing left.
Mm.
And it's very, very cathartic. It's very relaxing. Number 5, I think, would be exercise, making sure that you're getting about 3 to 5 uh, episodes of exercise per week, enough to make you sweat, enough to elevate your heart a little bit. whether or not it doesn't have to be fancy. You don't have to join a gym. You could just go outside and go for a walk in the sunshine and take your dog out for a walk. Do something. Go outside and play like you did when you were a little kid.
Mm.
And that number 6 would be paying attention to your nervous system and your posture and your joints through chiropractic care. I It's been proven time and time again to be very beneficial for people, uh, and in conjunction with the other steps that I said, this the 6 steps of wellness will help you to feel better, to move better, to have less pain, and just, be a happier person.
Man, I think so interesting about that is, as a chiropractor, we think so much in the world of musculoskeletal as movement, but you're kind of saying that there are four other things that you need to be focusing on, even outside of the movement, right? Movement is important. You got to be moving, you got to be exercising, but you're bringing up like nutrition, you're bringing up sleep, you're bringing up stress that all are preventative, not for just your mental health or your cardiac health, but for your musculoskeletal health, which is kind of radical, I think, for some people when they're thinking about, hey, I just want to be more limber and loose. Oh, I need to get better sleep and stay hydrated. But you're saying in the work that you're doing, that is imperative in that space.
Yeah, I mean, if you consider overall wellness, there's a lot health is very complicated. If it was super easy, we'd all be we'd all live to be 200. But, there is an argument to be made about proper nutrition. There's an argument to be made about proper hydration and making sure that you're getting enough clean, filtered water. There's an argument to be made about, um, s getting plenty of sleep, getting plenty of exercise, making sure that you're doing some stress management, whether it's in the form of meditation or guided imagery or just journaling or doing something to get to get your headspace in order. And the last one, number 6, would be the maybe the most overlooked one would be chiropractic care, where you're just working on your alignment and your joints and your posture and making sure that everything is loose and limber, and that'll keep you in good shape.
It People don't think, I know as a chiropractor, that's your world, right? Is the concept of being in line and those kind of things and posture. As you say posture, I'm kind of moving in my chair. If you're watching this on video, I'm like, is my posture okay? But it's like something you have to think
I
about it. Like,
it did not get missed on me.
but it's something we think about. Like, I know in my training and just different stuff. Like, if you're kinked up, we call it kinked up, right? You're just out of line, or maybe you didn't stretch properly or whatever. It impacts your entire day. It impacts the way you feel, not only physically but mentally. And so I do wonder for some people, not to say that someone's depression is because they're out of line, but to a point, maybe it could be, right? That, for some people, maybe they're hitting the nutrition on point. Maybe they're staying hydrated. Maybe they're moving. But you're saying just being out of line and not having that posture itself could be a driver to many things for a person's mental and just overall wellness.
Well, think about this. There's an old phrase that says, "When the as the twig is bent, so grows the tree."
Mm.
So a
Mm.
lot of the problems that people have today that see me and see you and everybody else, they started a long time ago. Maybe they have a scoliosis. Maybe they have a high left hip that causes their low back to get out of line. And that in turn causes their discs to start to wear out. These things take time. They take decades to materialize. And so sometimes people come in and they have some kind of a problem like arthritis, or they have a, 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 a a pinched nerve or something that's due to their pelvis being out of alignment in comparison to their lumbar spine, and that puts pressure on the discs, causing the discs to start to wear out or get thin, kinda like brake pads getting thin.
Mm.
And just like with your car doesn't it doesn't have a problem the minute you drive it off the lot. At least it shouldn't,
Hopefully.
right? I guess some do, hopefully, right? But, it takes time for things to wear down and the same as your body. Your body takes time to have problems or things like that. Um, there most diseases that we know about today don't you can't feel them starting. You can't feel cancer cells forming in your
Mm.
body. You can't feel, uh, your blood sugar levels rising. You can't feel your blood pressure going up a couple of points. You can't feel tooth decay. It takes years for that to actually cause a cavity and cause damage in your mouth. And, that's why dentists tell people to brush and floss and get regular checkups because they want to try to encourage you to prevent the problem from occurring in the first place, as opposed to waiting until it's a complete crisis and then here, take this pill right there. That's the mode that most people do is they wait until it's ready to blow up in their face until they're ready to do something about it. Whereas I'm more of an advocate of being preventative. That's why I talk about the 6 pillars of health and wellness and encourage people to do that stuff so that they don't have problems later in life.
Mm. And prevention is so key. I think that, if we focus on prevention so many times, health and wellness are just so much better, right? And it's easier to treat if something were to go to bad if you're doing a lot of prevention work. I know for you, you mentioned that absolutely you have this musculoskeletal concept. You're working on, muscles and nerves and those things, but you're also talking about there are other drivers to these chronic pain conditions. And you talked about doing like lab work and some of those other components. So what are you seeing in that world? What are labs that you're looking at? What are other root cause illnesses for these pain syndromes that people are having?
So, what I wanna do, let's just say that, for purposes of argument, that we're just focusing on one condition, say hypothyroidism, which is low thyroid function that
Which is
affects your
very
energy
prevalent.
levels throughout the day. Very, very prevalent. And, there's hidden root causes that cause this mechanism to dysfunction. One of them is autoimmune disease. So with autoimmune disease, it's your body's defense system. It's your body's white blood cells that are supposed to be protecting you. It's supposed to be helping you, uh, pr uh, helping you ward off viruses, bacterial infections, parasites, protozoa, all kinds of bad stuff. And so what happens is that it starts to mistakenly attack your own body. And it's whenever somebody comes in my office with some weird, mysterious problem that nobody can help them with, nobody can figure out what's going on, it's probably autoimmune disease.
Mm.
And, researchers have identified over 100 different autoimmune problems, depending upon which tissues are being affected. So if the immune system is attacking and destroying the thyroid gland itself, that's called Hashimoto's disease. If it's affecting the brain, that's called multiple sclerosis. If it's affecting the joints in your hands, that's called rheumatoid arthritis. Or if it's affecting the lung fields, that's called sarcoidosis. Or if it's affecting the gut, the large intestine, that's called Crohn's disease or ulcerative colitis. If it's the small intestine, it's celiac disease. So there's a the my point is that there's a whole bunch of different autoimmune problems, and there's over 100 that have been identified by researchers. Now, um, anybody that tells you that they can cure an autoimmune disease is lying to you.
Mm.
You cannot cure an autoimmune disease. It's part of your genetic mechanism. It's part of your DNA for the rest of your life. You can't switch it off like you can turn off a light switch. Now, but you can dim it down like yeah, the chandelier in your dining room, you can turn that down to make it dim and put it into remission. So it's no longer causing mischief, no longer causing pain, no longer causing problems. Um Another thing about autoimmune disease is it's kind of like a schoolyard bully. If he's picking on kids over here, he's probably picking on kids over here and here and here. And so people that have an autoimmune attack in one part of their body usually have something else going on, whether it's the thyroid gland, the skin, the joints, the brain, the gut, it can affect anything. So that's the first part that I look at is if they have an autoimmune problem. After that, then I want to identify what I call triggers. Triggers are things that are other than autoimmune disease that can cause disruption with your thyroid function, causing you to have low energy. So these are things like anemias, blood sugar problems, cortisol issues, which is your adrenal glands that send cortisol to your brain. It causes belly fat production and it causes brain fog. There are things like the sex hormones. There's the things like the estrogens and their metabolites, the progesterones, testosterone. Remember, boys and girls make both, and they have to be in the right amount for your gender and for your age. So, a 58-year-old man like myself is going to produce a different amount of sex hormones than a 22-year-old female. There is chronic inflammation, oxidative stress. There is gastrointestinal problems, problems with absorption of nutrients or with bowel transit times, issues with food sensitivities, food allergies, chemical sensitivities like household cleaners that you may have thought were perfectly innocent, but they are causing major problems in your life. And there are problems involving stealth infections or stealth viral loads like Epstein-Barr virus, cytomegalovirus, um, herpes, things like that. And the way that I identify each of these different triggers is by doing lab testing. And the lab tests come in the form of blood, urine, stool, or saliva. And by doing that, we can get an objective measurement of where that person is and where they should be and rebalance all these different systems to bring the thyroid gland back in line.
And I think what's interesting that you kind of brought up there is that is one organ, right? And one system that has all of these things going on in the body. And so I think what's important for a listener to hear is that, we talk about this space a lot on the show, but, no matter what you're going through, what you're experiencing, there is a gamut of reasons why this is happening. And so it's wildly important to figure that out. And just, I love how you just gave one example of this little bitty gland that sits right here that's super powerful, but that just sits right there, like, in your throat, that has so many different triggers and the lab tests and all those things. And every part of our body's like that. And so being able to
Well,
do that work you're talking about is so important.
well, let me ask you a question. When's the last time your primary care physician considered all of those as a potential mechanism for the problem?
Yeah, I think, I think that's something that many people are challenged with, is that as they navigate these systems, whether they're having like a little bit of a flare up or they have something weird going on, it's just easy. And I think, being trained as a nurse practitioner and those kind of things, like we get that world right of like, diagnosis, treatment, but there's so much more in it, and like you said, like in the people that are coming into your office with, I have the same thing, which is long lists of medicine. It's symptom management, but at the same time, there's something else driving it. And if you get that under control, you turn it down into that remission, man, it's a whole nother world for people to be living than just another med to decrease inflammation.
I've worked with a lot of nurse practitioners. I've worked with physician's assistants, a lot of mid levels, and they are, um, some of them are very holistic in their thinking, and some of them are very allopathic in their thinking. I think that there's a time and a place for all healing, and so what I tell people is start off by going to the medical doctor, start off by trying the pharmaceuticals and see if that can clear that out. And then if it doesn't, then we can take a look at it. 'Cause I really don't wanna be the first person that people see. I wanna be the last person that people see.
Mm.
I
Hmm.
wanna I wanna say to them, "You've already tried drugs. You've already tried, going to the doctors. Let's try something different. Let's try
Mm.
something that the guy hadn't done before and something a little bit unique and, go from there." And I find that some people are so in love with their drugs that they don't want anything but that. It's fine. It's fine. There's people out there, and there are some people that are very anti-drug. I'm not one of them. I don't I think that drugs can save a life. Drugs can help improve the quality of life for people. But I believe that as a people, we're over-medicated, and I'm trying to educate people as much as I can to prevent the reliance on pharmaceuticals as much as possible.
Well, I think you bring up a great concept of like in chronic conditions, which I know that's your specialty, is just working with people with these chronic illnesses, and chronic meaning like it's constantly happening. These symptoms are there. It's not like you just broke your arm kind of thing. It does seem like it's very easy for the brain to create this new version of normal. And so if there's a medicine or something that even though you haven't got it into remission or you create healing, if that new version of normal is better than the pain that you've been in, it's really hard to want to make a shift, even though you're not where you want to be. And I experience a lot of that with people, in just chronic mental illness, right? Like especially like serious mental illness, where a new normal is created, they're nowhere near where they want to be, but man, to come off the medicine is so scary, or to make a change is so scary. But if they did try that, like you're saying, you get the lab work done, you do those things, that kind of healing can occur. But I think that's one of the reasons why people really fall in line with a lot of medicine is that maybe it's not that for some people it's wildly healing, right? But in other instances, it just created a new normal that was way better than the normal that they had been living for years with chronic inflammation, all those kind of things.
That's an interesting point. I hadn't considered that. Um, I maybe it has a lot to do with, where they're at and what they wanna achieve out of this whole thing. Um, I never tell people to stop taking their drugs.
Mhm.
It's not even in my license to do that. So, I tell people, um, when they work with me, let's say, for example, that they're working with me for peripheral neuropathy, which is a problem with the nerves that leave the spine. I would say, go to your doctor that puts you on the gabapentin or the Lyrica or the Cytomel or whatever, and say, um, "Doctor, I'm working with a natural healthcare practitioner from Pittsburgh about my peripheral neuropathy. I'm feeling a lot better. My balance is better. The pain is gone. The tingling and the numbness is greatly diminished. I think that it's time that we had a talk about either decreasing my dosage or getting me off this drug entirely. What are your thoughts, sir?"
Mhm.
And if you approach people in a very polite way like that, I think that most medical doctors would be very, very excited to help them to get off that drug or to reduce their dose. But I believe that whoever puts you on the drug should be the one that take you off the drug. I mean, that's just common courtesy. So, but I
Yeah, and I
believe
think
that good.
you bring up a
Go
great
ahead,
point. I
please.
think, as a healthcare provider too, being open in that space, right? I know for me, if I've got someone that comes in and they're like, I think I'm ready to come off this thing. It's like it's so exciting, right, to do it. And I think we all have to be super open minded, but also remembering like we're the ones that started it, right? So it's our problem. This is our thing that we've got going on. And so when we've collaborated with people like you or whoever it's in that space, right, and they've found remission, being open minded in that, right? I think sometimes it's really easy to be closed minded, like, nope, that's fine. This medicine's what's got you there. That's what's got it. But really, it's probably not, right? It's just kind of manage your symptoms as you're doing that work. And so I think a true collaborative team looks like what you just said, man, is that ability to be
Yeah,
open and doing that kind of work.
yeah, exactly.
And I think that is a really great point. We were talking about the concepts of pain and some of those things, and I think something that we haven't talked about a little bit. And I'd love to get your thoughts on this. Is the concept of mental illness that then radiates pain, right? Like we see this a lot in depression, anxiety, especially in trauma, and some of these things where a symptom of the mental illness is a pain issue. How frequently do you see that in your world where, you've checked out all these things and really this mitochondrial issue or whatever it is also kind of creating this depression and anxiety, and it's all happening together?
I I would say that it's
Mm.
pretty common. I'm not a mental health care professional, so it's out of my scope to diagnose and speak intelligently about these types of problems. But I've seen that I've been in practice for 25 years, and I've seen thousands and thousands of people in that time, and I'm sure that a lot of people have bring to the party depression and other types of mental health challenges, and that also they have chronic pain. So maybe that's a it's a holistic thing. I need to start to refer these people out to a proper mental health care practitioner so they can approach it from another side, another angle, while I
Mm.
focus on the spine and other type of stuff.
I think it's such an interesting component because, for a long time, I'm sure you remember this, that if you couldn't explain it, then it was just like, well, probably a brain thing. And then they'd send them over to us in psychiatry and, we would assess them and do different things. And I think that it's all interconnected, right? We see that with the mitochondrial work that so many people are doing, like Chris Palmer's doing, in that space where there's something going on metabolically that's kind of creating these changes. But I also do see where when people have very persistent trauma issues, or maybe they had a lot of depression, anxiety, whatever that is, that these pain syndromes emerge, and they're having like chronic back pain or they can't do things. And so I think I've just seen that sometimes where if you can get like the depression and the anxiety under control, the pain also gets a little bit better. Right. But then you also see where when the pain's the problem, the depression and anxiety gets worse.
That's a very interesting point. I wonder if the people that are suffering with depression and anxiety and all these other mental health challenges are also paying close attention to all the other components of wellness and health, such as nutrition, hydration, exercise, sleep. All that stuff is very, very important. And I know that some people that have, say, anxiety, they don't get enough sleep. Their mind is racing all the time. It's churning and doesn't allow them to relax at all.
Yeah, I mean, I think you see that, in many mental health components, right? Those 6 pillars that you referenced could easily be replicated in that world, right? Of how frequently, I mean, how many kids I've worked with that say they have like really low energy or they can't focus and they're only drinking like 1 bottle of water all day long. It's like you need water to be able to focus and get your stuff done. So I think you bring up a really great point. But I think one thing, if we look at those pillars and put it in mental health, one thing we don't talk a lot about is being in line. You talked about that chiropractic care. Like how many people I see that will come in hunched over, kind of wore down, life has beat them down over the years, right? They're just so down and sad and tired. And so I do wonder how adding some of that in, whether it's root cause treatment or it's just symptom alleviating, would be helpful to some people in that space.
So let me ask you a question. What area in mental health do you kind of focus the most on? Do you focus on ADD or dementia or uh,
That's a great
behavioral
point.
problems?
Yeah, so for me clinically, I've always been kind of this generalist, right? So I've just done everything from 5 to 95, depression, anxiety, ADHD. We do get some dementia care, even though our meds are kind of like, eh. But they find their way sometimes in psychiatry, addiction, correctionals work, a lot of those things. So you do see a lot. But one of the things I see a lot in my practice, especially in like community mental health, is many people have these chronic conditions, right? So they're depressed, they're anxious, they have chronic back pain, they have hypertension, many of them have blood sugar issues, you know, by and large, there's some kind of thyroid kind of thing going on many times too. There's like all these different components in it, right? And so you're trying to engage and do different things. And in the functional space, not use medicine as much. I mean, use medicine if you need it, but you're trying to do food and supplements and all those kind of things. But something like I talk about movement, But I think you bring up a great point of the chiropractic care. Like, how many people could benefit just from getting their body aligned? Like you said, like not being that broken twig anymore. How important that would be for
Yep.
someone who's feeling unwell. I think that's something, if you're out there and
Well
you're thinking, I've done all the things, right? Like I'm eating good food, I'm drinking water, I still don't feel good. Maybe look at that because I think there's something in that.
well, I wonder with kids with ADD, for example, how many of them are really and truly focusing on nutrition versus they come home from school, they have a Diet Coke and some Doritos, and they play video games for 8 hours, and then their moms are wondering why they're bouncing off the walls at 10 o'clock at night. And they're
Oh yeah,
not
that
going
is.
outside, they're not playing.
Yeah, that is a huge,
Go
huge
ahead.
challenge that we experience in all of psychiatry, right? Where you have these, we know that some kids just don't clear the substances out of their brains very well. There's even some genes that are related to that, right? Where some kids just can't get the ultra processed stuff out of the brain, which is really interesting. There's some other components where you'll see just the overstimulation of like anxiety or the overstimulation of electronics and those kind of things be a trigger in that. So, yeah, I think you're right on the money.
Well, they're getting a massive dopamine hit from playing video games or playing on Facebook or watching whatever. I grew up in a different era. I grew up in the '70s, and back then you went outside and you didn't come home until the streetlights came on, and you played outside, and is a different world. Nowadays, kids have all the entertainment inside,
Mm.
and, they're being fed a constant diet of junk food in addition to overstimulation from electronics, and people are and then mom and dad wanna give them a pill to calm them down, and, I'm just again, I'm more of an advocate of the prevention model and doing certain things to prevent disease, to prevent behavioral problems, or prevent it could be mental health issues. But where does that transfer to pain? Probably not immediately, but it takes time and it takes uh they're probably going to gain some weight. They're probably going to not be as physically fit as they could be. And you're gonna or they're gonna start to hurt after a while, and that's maybe that's where you come in.
Well, I think you brought up something really cool is the concept of play, and I think that that's something that even as adults we forget about a lot. Like I was listening to a longevity expert not too long ago talking about how as we as adults age, we still need to be playing. Right. The
Yeah.
old adage that, what will kill you is the thing that's hard to do for you. Right. So if you can get on the floor and roll around, get on the floor and roll around. If you can I mean, anything that's hard, be trying to practice those things because ultimately those are the things that's going to help you live longer. And so it is interesting, I think, that when we think about if you grew up playing, you at least have a template of how to play, even though you kind of lose it as time goes on with work and all the other things. And so we have to really work to find it. But if you're a kid and you never get that, you don't know what play looks like outside of that.
Yeah.
What does
Yeah,
that look like
exactly.
40, 50, 60 years old when you as the chiropractor, like, you gotta move, man. Like, you gotta get up and shake your body around a little bit, do some dancing, do something. It's just, where does that come from? There's no template for it.
When I was a kid, they didn't have play dates. You just went outside. You got in trouble, you ran around. There was, there's something nice about 2 kids in a yard and a stick, and that's it. And nowadays, it's you got too much I don't know, helicopter parents or being overprotective of their kids or whatever it is.
Yeah, I mean, I think there's definitely gamut things, but I also think too, like, we have parents, and I'm not a parent as I speak on this, but like, I think parents and guardians, whoever, like, we've also forgot about how to play. Life has beaten it to
Yeah.
the place that we don't know how to play now. So it's just hard to even imagine what play looks like. Where I think about many parents, like, gosh, my dad, for example, he would play with us constantly. Like, we were constantly outside doing some kind of, like, game or play. He played just like we did. And so I do think that, as a guardian or whatever you're doing, if you're in a kid's life, you gotta play. Like, and so you gotta help them learn how to do, and ultimately too, it's gonna help you live longer. Like, you're gonna feel better because if you're rolling around on the floor, if you have the physical ability to do it, man, whatever you can do, and even if you can't, working with people like Kevin, of where helping you get loose and limber and doing those core wellness components. I know there's a lot of people out there that are trying to do fitness and health solely just so they can be the parent they want to be. And I think that, if that's where you're at, you got to do that.
I agree.
Yeah, I think that that's definitely something. So as we kind of like look at this and kind of, move into application, right? You talked about your 6 wellness pillars that are really important in prevention. If anyone out there is like listening to this and they're like, I don't know what to do with my pain. I don't feel well. What can they do? What do you recommend for them as they navigate this system of unknowns?
Well, I would say that, um, just pay attention to the basic building blocks that build health and wellness, and you should feel a little bit better. If you focus on exercise, if you focus on stress management, if you focus on making sure that you're getting enough sleep, you can research different ways to do that. There's different models of sleep hygiene, like not looking at electronics after 5 p.m. or 6 p.m., making sure that your room that you're sleeping in is at the right temperature, that you're taking a bath or a shower beforehand. You drink a little bit of chamomile tea and read in a book, and just prepare your mind for sleep, so that you have more of a potential of getting a good night's sleep the day before. I think that
Mm.
goes a long way.
Well, and I think what's important of what you talked about today is within those concepts of the 6 pillars. Many times in medicine, we're thinking through the concept of like triggers, right? Like what has triggered you? But I think something that can happen, you tell me what you think of this, is that if you solely focus on a trigger, right? A thing that's making you have pain or a thing that's making you feel unwell, and you're not doing this other stuff, you're kind of like a setting duck for all things to be a trigger. But if you focus on those core components, then if that thing actually does trigger the pain, that's a true trigger, right? Does that sound kind of, that makes a little bit of sense for people?
It does. I think that, just doing something is better than doing nothing at all.
Mhm.
And, a lot of times, um, it all boils down to your habits. Good habits build good health, bad habits build bad health, and, maybe start off by reading the book Atomic Habits
Mm.
and learn what can you do to improve. I don't we want progress, not perfection. But as long as I think you're drawing a breath, I think that everybody can get better.
Yeah, yeah, I like that, and just trying to go and, we recognize, like, in the concept of pain or whatever it is, right, that suffering, I mean, just to get up out of bed sometimes is the greatest challenge of the day, right? But like you're saying, just those little bit of movements, and if you focus on those 6 pillars that you presented, focusing, working with someone like yourself to get that chiropractic alignment going on and trying to get your body aligned and what that looks like, there's some really incredible healing that can occur in that. And then I think
Yeah.
then you find your triggers and you find those things. Interesting stuff, man. It's cool kind of seeing the functional health component kind of lay over the chiropractic world, which is pretty interesting alone. And then what that looks like as it bridges over into all the other health components of life, systems, and those things. Cool stuff, man.
Yeah. So I guess in closing that, what I wanna do is, some of your listeners may be wondering or listening to this podcast and saying, "Well, that sounds really interesting. Uh, how can I learn more about this? How can I get back in tune with some of the stuff that he's talking about?" I would say that the best way to do that is to go to my website. It's at metabolicsolutions.net. And if you go to metabolicsolutions.net, I have a free health assessment quiz that you can do. It's completely free. It take you about 2 minutes, and you can figure out where you are in the grand scheme of things,
Mm.
whether or not it's a very mild issue that can be corrected by just doing some lifestyle modifications, or if it's a major problem that you need some professional help, there's a way to do that too. So just go to metabolicsolutions.net, take that free quiz, and you can help yourself that way.
Absolutely. And we'll connect that in the show notes, right? So if you're listening on a podcast or any of your streaming platforms, it'll be there in the show notes. If you're watching this on YouTube, it's right there below as well. And all of Dr. Kevin Smith's information, you can definitely reach out to him if you want to follow his stuff on all those cool platforms and those things. Kevin, thank you so much for being here, man. I think this was really interesting. These 6 pillars are definitely something I'm going to be contemplating through my day. Not only my posture as I'm sitting here for the rest of the day, but also my hydration and all those things. I've got to be very aware of that as I go through my day.
It sounds like a plan. Thank you very much for having me.
Awesome, man. Have a great day.
Thank you.